Hello, and thank you for joining today's special webinar entitled Community Connections, Lung Cancer, Support, Survivorship, and What's Next. In this installment of the Community Connections Health Series, we'll be discussing what it really means to live beyond a lung cancer diagnosis and how patients, survivors, and caregivers can navigate the road ahead with confidence, support, and the right resources. Today's discussion will explore survivorship at every stage of lung cancer, managing the physical and emotional aspects of treatment, supportive care resources that can improve quality of life, and strategies for staying connected to care and community throughout the journey. My name is Ralph Cordero, and I'm a firefighter with Miami-Dade Fire Rescue and a volunteer with the American Lung Association. I'm excited to be here today, serving as the moderator for this cutting-edge panel discussion with two experts from Sylvester Comprehensive Cancer Center, partnering with the American Lung Association. Before we get started, I'd like to share a brief video from Sylvester Comprehensive Care Center.
When I got the news,
my whole world stopped.
I had cancer. My first choice for care was clear.
only Sylvester Comprehensive Cancer Center had treatments no one else could offer.
And a team of experts for my cancer.
Always by my side.
Only Sylvester could get me back.
Here.
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 All right, now with that, I'd like to allow our panelists, Dr. Frank Penedo and Dr. Estelamari Rodriguez, to introduce themselves. So, Dr. Rodriguez, if you wouldn't mind.
Thank you, Ralph, and thank you, American Lung Association, for this invitation to come and speak to you this morning. I'm a thoracic oncologist, clinical research lead of the thoracic program at Sylvester Comprehensive Cancer Center, and I specialize in lung cancer, so I have the privilege of taking care of patients and their families through the whole journey from diagnosis and treatment, and glad to be here.
Thank you, Ralph, and thank you to the American Lung Association for having me here this morning. I am Frank Penedo. I'm a professor of psychology and medicine, and I have the privilege of directing our Cancer Survivorship and Supportive Care Institute here at Sylvester. And most of the work that I do also focuses on research that's conducting to improve quality of life, emotional well-being, and other outcomes in cancer survivors.
Sounds great. Thank you both for joining us today. So let's get this conversation going. Now, to kick us off, I'd really like to hear from both of you about what survivorship means to you. We hear the word survivorship more and more in cancer care today, which is great, obviously. For someone newly diagnosed or currently in treatment, what does survivorship actually mean? And when does that journey begin?
Well, survivorship journey begins really at the day of diagnosis. And you may ask, why is that the case? Why do we start at the day of diagnosis? And what we want to do is that we want to ensure that once the diagnostic process, the treatment planning, and the initial cancer treatments are completed, that the patient, their care team, and their loved ones are truly oriented to the survivorship experience. In cancer survivorship care in itself, it's really the ongoing coordinated care that we provide to help people with a history of cancer manage treatment side effects, monitor for recurrence of new cancers, and support long-term health and quality of life.
I think for me, I think survivorship looks different for every patient and family, and I agree it really starts at diagnosis and beyond treatment, and really understanding that as much as lung cancer has changed and there's so much hope, so many treatments that were never available before we have available today, survivorship is a long-term journey, and sometimes even our treatments leave us with side effects that we need to manage in the long term. So I think survivorship is about understanding that it's a journey and that there's hope and that support is needed through the whole process.
Excellent answers. Thank you so much. So also to Dr. Penedo, one of the questions we received really speaks to what many people may silently carry. A participant shared concerns about worrying that a life-saving or miracle drug could someday stop working, and the fear of not knowing what comes next. Now, Dr. Penedo, how can patients cope with that uncertainty?
Ralph, that feeling of uncertainty is not only very common, but it's really one of the most distressing aspects of a cancer diagnosis, from concerns over response to treatment, the ongoing treatment side effects, the fear that comes along with that, and concerns whether the cancer is responding or not, whether it will return or not, can it spread? All that can be extremely overwhelming for patients, their families, and loved ones. One key approach is to assess what is manageable about the condition. What is it that's controllable? It's sort of breaking down that overwhelming experience of uncertainty into parts that one can control, like seeking information, planning ahead, for example, of a discussion with the providers to address those very thoughts and concerns that the patient and their loved ones may have, and also learning ways to reduce the distress that comes with that uncertainty.
Okay, great. And so what are some of the healthy ways that patients can do some of those things that you mentioned to manage that uncertainty or that anxiety without feeling consumed by it?
So fortunately, there's many evidence-based techniques that are available and tools that can help reduce that anxiety and other feelings of depress. Relaxation strategies, for example, and exercises like deep breathing, meditation, and mindfulness can all be very helpful. Also, it's very important to try to stay as active as possible and as social as possible, particularly nourishing relationships and social support. When the feelings of uncertainty and anxiety persist and interfere with day-to-day function, even more formal approaches like support groups or even individual psychotherapy and full psychiatric evaluations can be very helpful to our patients.
Oh, it's great information. Thank you. So to Dr. Rodriguez, one attendee asked about the newest treatments for stage 4 lung cancer and how survival rates have improved over time. So Dr. Rodriguez, can you talk about some of the advances you're seeing and why there is more hope today than ever before?
That is a great question. Thank you. And, I think today, precision medicine, which is understanding the mutations that cause lung cancer for individual patients, immunotherapy, better screening procedures have really opened a lot of hope where we have more survivors than ever before. I mean, even this conversation about survivorship will be not well attended if we did it 20 years ago because we didn't have a lot of effective treatment. So now we do. And I think what is really critical is for patients to understand that every case is different and that you need to find a team that understands your particular diagnosis. And that includes doing biomarker testing, which is testing for mutations. That has been truly what has really improved outcomes for patients. We have patients today that the average patient for some of this targeted therapy lives 6 years. So obviously more than that, we're seeing survivals in years because some specific patients have these mutations that if you find them, you could do better. But if you don't find them, then you don't do better. So I think what is critical here about understanding that this progress requires that you have the right team making decisions together and also the right team trying to understand the tumor. So that includes biomarker testing so that you pick the right treatment from the beginning and also get access to that treatment. And that may include finding a multidisciplinary team that can use not only a pill, which is a targeted therapy, but sometimes immunotherapy, radiation, surgery. All of these tools can be used to improve outcomes for patients. So working with a team to find the best individualized option for you and giving yourself as many options as possible by getting all this information.
Excellent. And it seems like you already touched on part of my follow-up question with biomarkers and targeted therapies. Excellent. So what are some of the biggest breakthroughs patients may not realize are happening right now?
So I think one of the biggest breakthroughs and information that we are going next week to the Global Oncology Conference in the United States, ASCO, and one of the things that is going to be talked about is how to move these targeted therapies in earlier stage disease. And I think what we're learning is that understanding these mutations and finding the patients that have these mutations, we can offer more cures if we start treating them earlier. So getting this information very early. We're also learning that immunotherapy, which has allowed some patients to actually be cured from metastatic lung cancer, which is something that we never imagined could happen 20 years ago. Today, we have patients that presented 10 years ago with metastatic cancer and they're still here. And some of these patients have had extraordinary responses to immunotherapy. And what we're learning is that you can also add immunotherapy earlier on before surgery. And why I think it's so critical that if you get diagnosed at any stage, you connect with a team that has an oncologist that understands how to really optimize your treatment by using all these new technologies up front.
Excellent, excellent. Now, we're going to break from our general script here because I just got a message in the chat that I want to add in here. So many patients and families feel intimidated navigating the appointments, treatment decisions, and medical information. Dr. Penedo, what does it truly mean for a patient to be their own advocate? And what are some of the practical ways they can feel more empowered throughout their care journey?
Yeah, absolutely. That's a great question and a great comment also. Think of it in pragmatic terms. Our patients are consumers, and we're providing a service for them. And we often hear that patients are a bit hesitant, even shy to ask for more information, or if they're confused about their treatments and are not getting the whole picture. Maybe they hesitate to really question their providers because they may think the providers are viewing them as nuisance or that they're not doing a good job. We couldn't be farther away from that being the case. Providers want the patients to be fully engaged. They want the patients to be their own advocates also. And we highly encourage our patients to be assertive and proactive in asking the questions and navigating the health system. Now, that doesn't mean that it's easy, right? So we have patient navigators, we have health coaches, we have nursing teams that help the patients navigate these very complex issues that they may face. But I think the take-home message is that it is the right of a patient to fully understand their care and fully understand how they're going to navigate that journey that will take place in their survivorship experience.
Excellent. So while I'm with you, Dr. Penedo, in your work with survivorship and supportive care, what are some of the factors that help patients stay resilient throughout treatment and survivorship?
Yeah, that's a great question. So the concept of resiliency has gotten a lot of attention in the past several decades. And what we know is that despite the challenges and the very difficult circumstances that many of our patients and survivors face, many of them have developed a set of resiliency skills through their life experiences that really apply to managing their diagnosis and the survivorship experience. That's not to say that every patient brings that set of skills, but we know what works and we know what helps. For the patients that bring those skills, we can help promote them. For those that don't, we can help educate them and teach them how to activate those skills. So a couple of examples would be problem solving and planning, something I mentioned earlier when advocating for your own care. Other areas of resiliency are emotional regulation, being able to better cope with anxiety and distress, having sort of a toolkit or a set of skills that can get activated when things get too overwhelming. And I cannot overemphasize social connections. The willingness to seek support, to communicate needs, to avoid isolation are critical. And we know that not everyone has a broad social support system, but even if it's joining support groups or attending activities, festivals, events that bring together survivors and the community of peers really, really goes a long way to help these individuals navigate the challenges. And that's all resiliency in and of itself.
That's great advice. We humans truly are social animals. So, Dr. Rodriguez, one attendee asked us, what can we do to best prepare for things like lung surgery and cancer treatment? So, what practical advice would you have for patients and families before the treatment actually begins?
So this is a great question because I feel that when someone gets his diagnosis, it's so overwhelming that it's hard to kind of step back and think, and that's when you need people around you that help you through this process because you need to do your research. You need to, if you need surgery, you need to find a surgeon that specializes in lung surgery. You need to find a team that has multidisciplinary care, meaning that they have teams that discuss cases together. They have clinical trials so that you have the next available therapies or the next best therapies close to you. And also that they have experience with difficult cases. So I think you kind of have to do your work to find who is the expert or the center. And we have patients that have two doctors. They may have a doctor in an academic center and they may have a doctor locally in the community, and they can benefit from the input from both teams. So I think you have to do your work, especially if you need surgery. You need a surgeon that has experience and that is also involving other parts of the team because we don't work alone. So a surgeon needs an oncologist to give input. An oncologist needs a radiation oncologist to give input. So you want to find a team that specializes in lung care. And then to do your work, one of the things I have seen patients and older patients do now is really going online, even with ChatGPT, you can come up with questions because sometimes it's kind of hard to organize your ideas. And you can just say like, I'm a newly diagnosed patient, what should I ask? Because you're like, it's so overwhelming. And some of these questions are very helpful and I like them. Like we sit there and I feel people are getting what they want to get out of it. But I do take Dr. Penedo's point that you can be an advocate, and it's not that you have to get all your questions answered in that first visit, but you should feel comfortable that you can come back to your doctor to ask questions again. And sometimes you have to ask questions 10 times before you understand what the plan will be. And also sometimes the doctors need time to come up with a plan. So I think you need to find a team that specializes in lung care and is multidisciplinary in their approach to the care.
That's great information, and it's fun to know we don't need to fear ChatGPT so much if we use it properly. So back in the chat, we have another question here. So one of the questions we received was about survival rates and what they really mean for patients today. So Dr. Rodriguez, when patients hear statistics online or after diagnosis or after they ChatGPT, how should they interpret those numbers? And why don't they always reflect an individual person's outcome?
Yeah, that's one of my favorite questions because I think patients want to know. And I also feel that doctors need to answer this question. But what I tell my patients is that when I meet you, before I get all of the information, including the biomarker testing, I don't know how you'll do. And some of the statistics that are found online by the SEER database, which is a national database of cancer centers, includes patients who never get treatment. So that might not be, obviously, they're not going to do well. Includes patients that never got the right treatment, and that it's not going to be you. So those numbers always underestimate how good people can do. And so I can't answer that question for people. It just gives you like a ballpark of what has happened. But we only care about how you will do. And your survival is 100%. So right now, and we need to keep it there. So I think you need information to answer that right. And you need to look at statistics with a little grain of salt. Now, when you have a cancer that the majority of people do eventually progress, you need to know that too, because you need to understand what the future will look like. And your doctor should be open about when treatments are working, what can we expect, how do we expect, how long can these drugs work? We never know. Doctors actually have looked at this. Doctors always get these estimates wrong. But you need a ballpark so you can plan your life and your plans and your vacations and things that you need to do. But the statistics can be dangerous because they include people that never got treated and got the wrong treatment.
Gotcha. That's very understandable. Great. So on to Dr. Penedo again. So for this question, you've already touched on some of these answers, but if you can reiterate, for those patients who feel overwhelmed navigating the healthcare system, again, what are some of those practical ways that they can advocate for themselves and build a strong support network?
Yeah, I think touching on Dr. Rodriguez's comments, I think being informed and educating oneself about the diagnosis and the potential treatments that are available help frame that advocacy for the patient because they can start understanding what are the right questions to ask here. Also, again, reiterating that they have the full right to ask these questions and to be fully informed. No patient should walk out of a clinical encounter feeling that they were not heard and feeling that they did not understand the directions or the information that was given to them to a certain degree that they feel comfortable with. So being assertive, again, I know that that's difficult for some of our patients, but that really goes a long way. Also bringing a patient advocate, a family member, a caregiver, a close friend that can help advocate for them, it's extremely helpful.
Excellent. So, Dr. Rodriguez, we also received a question about what may be on the horizon for patients with EGFR positive lung cancer who may eventually become resistant to Tagrisso. What developments are you most encouraged by?
That is great. So EGFR positive lung cancer is actually now 20 years since we've known about this particular genetic mutation, initially thought to be only in women of Asian descent, but it's truly found in any patient who can have lung cancer, many of them who never smoke, and younger patients. And there's been remarkable development of understanding this mutation and offering treatment. So you mentioned Tagrisso, that's a third generation oral targeted therapy that has done an amazing job of controlling cancer, but those patients can eventually develop resistance. So what I'm most excited about is going to be a couple of things. One, that some things that are already here, which are drugs that target resistance mutations from the beginning to prevent that resistant mutation, and they do a better job of protecting the brain, which is a site of recurrence. And we're seeing patients that are now living longer because of these better approaches, being more aggressive up front. We have new antibody drug conjugates that are being delivered. These are new designer drugs that bind receptors and inject chemotherapy, and in doing so, they're being more targeted in a way as a chemotherapy. So we are excited about that, and we will hear soon about how to really introduce immunotherapy for patients with EGFR positive lung cancer. There's some trials that are going to read out this summer that will shed light in which patients can benefit from immunotherapy with EGFR positive lung cancer.
That is excellent. Great information so far from both you. And I know, chat, I'm zooming through a lot of these questions because this information that we're receiving is fantastic. But please remember, this is interactive. So if you have questions, just put them in the chat and we will see if we can get them answered either today or later on. All right. So to both of you, we also heard concerns about dealing with side effects after chemotherapy and treatment. So I'd like to hear from each of you. What should patients know about managing side effects physically and emotionally? And when should they really speak up?
Can I take that one? Because I was in clinic and I spent a whole 20 minutes talking about managing side effects. So a lot of these wonderful drugs work really well, but they also mean that patients are now dealing with new side effects. And some of the EGFR positive drugs that we were talking about cause significant rash toxicity. And it's something that, yes, you're more comfortable and it's not chemotherapy, but it's something that people can see, and it's something that makes your quality of life, even like changes around your nail beds. I had a whole conversation with a patient about this, about how it's very subjective. Like I could look at your nails and they look not that bad, but for that particular patient, it's something very difficult. So I think what I tell patients is that they need to be very proactive about communicating. And this is what Dr. Penedo's point about being your own advocate. You don't want to let any side effect become so bad that you ended up in the emergency room. The moment you start having something that feels uncomfortable, you want to have an open conversation, because there's a lot that we can do to make it better. Number one, we can hold drugs and we can lower doses of drugs, and that happens in clinical trials, and people benefit the most when we do that. And also we have drugs and supportive. We have dermatologists that can help us. We have a lot of other specialists. So we want you to stay on drugs. So we need to hear about the side effects early and know that we have tools to make them better. And even if we have to hold the drug, sometimes even with immunotherapy, we used to have patients that wouldn't tell us they were having diarrhea because they didn't want to be taken off of this drug. They were scared that they would get really sick, and they would end up with horrible side effects, hospital admissions that could be really dangerous. And then we could never use this drug again. So I think you don't want to let it go to that point. Don't hide the side effects. We need to know about them so we can manage them better.
Excellent. Dr. Rodriguez, I'm sorry, Dr. Penedo, do you have anything to add to that?
Yeah, I mean, couldn't agree more. And if I may just add that we're getting much better at monitoring these side effects and toxicities for the very same reasons that Dr. Rodriguez mentioned. We want to make sure that we start to capture the patient's voice and experience, not only when they're coming in for an appointment, but also at their homes through the patient portal, through apps that monitor these symptoms. And what that does, it lets us identify whether dose modification needs to take place so that the patient can remain on the treatment they're at, but maybe at a lower dosage to avoid some of those toxicities or side effects. You also mentioned about when is it important for them to tell us that they're having the symptoms, when it bothers them, when they feel there's something not right, they should feel completely comfortable in telling us.
Excellent, excellent. So, Dr. Rodriguez, one attendee asked about prevention of recurrence. While obviously every case is different, are there lifestyle habits or ongoing care strategies that can help patients stay as healthy as possible after treatment?
So that is a great question. And, I think it's actually this whole area of lifestyle is actually new to thoracic oncologists, because we only used to have patients that were on oxygen and had poor lifestyle, and now we're having patients that are living full lives with better treatments. And so we have to do a better job to maintain that quality of life, and that means eating well, nutrition. It means moving, exercise so you could breathe better. It means talking about side effects to your doctor. It means taking care of your mental health. So all of these things are part of survivorship and prevention. The other thing, there's a lot of stigma with smoking and lung cancer, but there are patients that have lung cancer, and tobacco was a big part of it, and making sure with no judgment that we support them in their smoking cessation efforts, because we know that at any point that you stop, you do better in the survivorship, you have less recurrences, and even in your treatment, you do better. So with no judgment, we want to hear from you, and actually our patients don't feel comfortable. We know that when we ask them online if they're still smoking, I know many patients feel judged because we have judged them in the past, and they don't tell us, and there are tools to make it better. So that's also, I think, a really important part of prevention, not only the lifestyle modifications, but also smoking cessation if that's part of one of your risk factors.
Excellent, excellent. I'm going to sneak one last one in before we start wrapping up. Dr. Penedo. So we've been talking a lot about patients. However, caregivers are such an important part of the cancer journey, but they often put their own emotional health last. What advice would you give caregivers for supporting a loved one while also taking care of themselves?
I'm so glad you asked that question because it's often overlooked, the burden and the toll that cancer takes on caregivers. It is important for them to make sure that for them to be able to take care of their loved one, their friends, their close circles that are experiencing cancer, that they're also mindful about how they're doing and they take care of themselves. There are programs available for caregivers. There are some support groups available that help them navigate the challenges and experiences of caregiving for cancer patients. We have learned a lot from the Alzheimer's literature and science that has been conducted, given that it's such a chronic and debilitating condition. And a lot of those models are applied also to oncology, where we provide the very same skills we provide our patients to caregivers to manage the distress. It's critically important that they take care of their own health as well.
Excellent, excellent. So as we begin wrapping up, what is one message each of you would want to send to every patient, survivor, or caregiver listening today to walk away with? So Dr. Rodriguez?
Oh, lung cancer is still the leading cause of cancer death in the United States, and why this is so important that we sit together to tell you that there's hope and that there's life beyond this diagnosis, that you can have good quality of life, and that you can find a team, not only the support team around you, but a support team in the cancer center and your oncology office that can help you through this process. So we just want people to know that there's hope. That hope may mean that you do the right testing so you get the right treatment option that gives you the best survival. Hope also means that you're open to new options like clinical trials. So just want to have people have hope and seek care. We still have, unfortunately, a lot of patients in our country who don't get any care for lung cancer when they're diagnosed, and they don't get any testing for any of these very important biomarker tests. And this is your right. If you have this diagnosis, your insurance will pay for these things, and your doctor should discuss them with you.
All right, Dr. Penedo.
I think it's important to convey that this is a journey. We're at every step of the way of this journey with our patients. It's a journey full of hope, and also a journey with tools and services that are provided that are available to our patients, to their loved ones, to their caregivers, and also understanding that all these services that we provide, whether it's psychoeducation, whether it's music therapy, acupuncture, these are all based on decades of research that had shown to improve the quality of life of our patients and our survivors. I think it's really important to also recognize that in survivorship, one size doesn't really fit all. Patients are very variable. They present with very different concerns and challenges, and also with very different resources. And one thing that I'm very excited about is that now we have the ability to look at big data and try to understand how do we provide that precise care to the patient based on how they're presenting and what their challenges are. The voice of the patient is critical, and we're really doing a lot of innovation in getting that right level of care at the right time to the right patient.
That is excellent. I'm so sorry to be cutting this off, but that's all we have time for today. Thank you again to Dr. Rodriguez and Dr. Penedo for sharing your expertise, compassion, and insights on navigating lung cancer survivorship and supportive care. Today's discussion highlighted an important message. No one should have to navigate lung cancer alone. Whether someone is newly diagnosed, actively in treatment, living with metastatic disease, or adjusting to life after treatment, support and resources are available every step of the way. To learn more about Sylvester Comprehensive Care Center, resources, and current trials, please visit the link on the screen. Additionally, the American Lung Association is committed to advancing research and the steps needed to defeat lung cancer. When you support the American Lung Association, you are supporting one of our greatest partners invested in this effort with us. Together, we can create a world free of lung cancer and lung disease. To explore the American Lung Association's resources, tools, and ways to take action, please visit the link on the screen. Also, don't forget to follow the South Florida American Lung Association on Facebook for announcements regarding our next community connections and webinar events. Follow the ALA at LungSofla, Lung SOFLA for details. Until next time, thank you all, and remember, together we can improve life one breath at a time. Have a great day.